1346th day of continuous webinar conducted by International Forum for Promoting Homeopathy. We welcome all to this session. Today, our guest is Dr. K.P. Nandakumar, MD from Kerala. In the session, 1 minute silent prayer. Thank you all. As you all know, the International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and homeopathic doctors. And we have conducted as many as 1,345 sessions already. And we have 3 sessions in a row every day. And the first session is already over by in our Hindi session just now. And from 8 to 9, we have our international session in English, and 9 to 10, our local language session in Malayalam. Today, we have a wonderful guest from an international faculty, Dr. K.P. Nandakumar, MD. He is the chief consultant, Amrita Homeopathic Hospital, Palakkad in Kerala. And this is one of the biggest homeopathic hospital in private sector in Kerala. And he is one of the person who is an expert in treating most advanced cases in particularly renal, cancer, liver, even cardiac cases. So that is something great as far as Dr. Nandakumar is as a doctor, as a person. And he is a person who always enjoy the beauty of music, as well as he is a person who always sing songs, not only for we homeopathic doctors, but he is also one of the person who was wanted by the public also in that way. He is the chief faculty at 3 conferences in a row in Toronto in 2023, and he has done presentation at Dubai, Bangkok, Canada, USA, UK, etc. And he has trained most of the homeopathic doctors in government sector for so many years, and he is one of the biggest wanted faculty for homeopathic doctors in Kerala also. That means he is a person who teaches homeopathy nationally and internationally. And he has completed more than 30 years of experience with homeopathy, and his son is also a homeopathic doctor by profession, and he is a winner of many awards. He has won the most prestigious award from Kerala, that is Dr. N.K. Jairam Award, and with Vaidya Shrestha Puraskaram, Rotary Excellent Award 2022, and Tejasvi Puraskaram 2022, etc. We have to say a lot of things about Dr. Nandakumar, but I am not elaborating about all those things. As you all know, today we are discussing about the management of pathologically advanced cases with homeopathy. And let us see, let us wait for the session. Dr. Nandakumar is always there. Already, Dr. has presented so many presentations earlier in our sessions also. We proudly welcome you to the session, Doctor.
Can you hear me, Dr. Dhanesh?
Yes, yes, yes.
Okay, thank you very much for this opportunity. And once again, I am there in this forum. And before starting this session, I would like to tell all the participants that this is a wonderful opportunity for all the practicing homeopaths to get in acquaintance with the different doctors all over the world and share their experience, and so that you can apply in your day-to-day practice. Homeopathy can be promoted only by one thing, by curing diseases, nothing more, nothing less. So here I am going to share my experience in treating pathologically advanced diseases with its evidence. Before starting the session, I would like to tell you that I don't know any one-dose magics. I'm not a magician. So I gave multiple drugs, repeated doses. For me, result is more important than philosophy. So if anybody has any different opinion, please pardon, but just listen to me. That's all. So that's in all my classes, I used to tell this, don't feel bad about that, because I am here to share my experience and I am here to say the truth. So we'll just go into the main session. Ganesh, can you
Yes,
see
yes,
the,
yes, yes, it's coming. It's coming. First page, management of
okay,
pathologically advanced cases.
no, yeah, clear?
Yes, yes, it's clear.
Okay. So it's a deliberate attempt from my side when I use the word management, because in many of our programs, as well as when we homeopaths speak, we use the word cure, 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 left, right, center. But a cure happens, especially in pathologically advanced diseases, when you manage the patient well for a stipulated time, maybe few months, few weeks, maybe even years. If you want to produce a good result in diseases like malignancy, you have to manage the patient for maybe months or years. So holding the patient, managing the symptoms, keeping the patient in a very comfort zone is very important, because then only you get the patient. You have the patient with you. Otherwise, the patient will just fly off from you and go to some other option. They will take some other options. So I don't want to waste time because we have only 1 hour. We'll straight away go into cases. First, I will show you a case of brain tumor, 2 cases of brain tumors, which was completely resolved with homeopathic medications, homeopathic treatment. And you can see the experience of the patient first, sharing their experience. You can see the subtitles.
Oh dear, it's not clear. Audio is not. We can't hear though. We can see the
But
subtitle.
even if the audio is not clear, I think you can, the strip is there. It's written in
Yes.
English. I think you can read that. And this is the MRI taken before the management, before the treatment. You can see that multiple ring enhancing lesions as described, suggestive metastasis. In the MRI, when you take the MRI of the brain, the malignant lesion of the brain, in the language of the MRI, it is mentioned as ring enhancing lesions. So here you can see multiple ring enhancing lesions in the brain, which shows metastasis to the brain. Now, after treatment, you can see the MRI. The patient's name is Samsudin, no ring enhancing lesions. There's a complete, all the lesions have resolved. And it took nearly 1 to 1.5 years for me to get such a result of complete resolution of the lesions, no ring enhancing lesions detected. Now, the prescription. We all know that Dr. Banerjee, Dr. Pradeep Banerjee has done a lot of research in the management of brain tumors with Rutasics. The research was done in Anderson Institute of Oncology in Texas. So after going through the research papers, I found that it's more scientific application of Rutasics in malignant tumors of the brain, because there the research was done not like giving the medicine to a patient, it was given, it was in the research was done by culturing the tumor cells, in a petri dish. And then the Nutra-6 was applied and series of uh, slides. Series of slides was taken to monitor, to study the changes that is happening in the tumor cells after the application of Nutra-6, the telomeric changes. So that's how the research was done, which was more scientific. That's how the medicines are researched nowadays. So it was very interesting to me when I came to know about this application of drug few years back, maybe 20 years back, when I was into the international scenario of homeopathy in 2000, maybe like. So initially when the research was done. So the application of Ruta-6 and Calcarea Force 3X. So still now, after 20 years, I think my favorite prescription in treating brain tumors is Ruta-6 BD, that is twice daily, and Calcarea Force 3X BD. The Calcarea Force, the action is that scientifically, if you ask, it promotes the tumor necrotizing factor, TNF, in our body, and thus it destroys the cancer cells. So I will show you one more example, one more case where a complete cure has happened. It's a pituitary macroadenoma. You can see its experience, but it's a long video. I will just go through it. Stop it once. It's a long conversation. Okay, you can see the first MRI which is taken before the treatment. It's non-enhancing pituitary macroadenoma, and his name is Abdul Haq. You can see here, Abdul Haq. Then after the medication, Abdul Haq, likely to neurosarcoid resolved. When compared to the previous MRI studies, most likely to be neurosarcoid resolved, normal study. Again, my prescription is this Ruta-6 BD and Calcarea Force 3X, but intercurrent remedies was given depending upon the symptoms of the patient. If you ask me, from my experience of 30 years, I should say that there are a few other drugs also which I have found very effective in treating brain tumors. One is Plumpum Met, and my choice of potency is 0/1 to 0/6. And also tuberculum intercurrent remedy has been given. Plus the management, if some patients, if they have dyslexic or aphasia, and all this speech is not good, and there is severe aphasia in some patients, then Calibrome has produced some good results. So like that, the intercurrent remedies has to be given in between during simultaneously treating the disease. So now it's another one, a bilateral choroid plexus cyst. The significance of this particular case is that choroid plexus is usually seen in intrauterine babies and now detected in ultrasound scans. Now this was detected at you can see bilateral choroid plexus cyst of a 6 months old, 3 months old baby. The first the scan taken in the first trimester showed the bilateral choroid plexus cyst. So the mother doesn't want to abort the child or terminate the pregnancy because she became pregnant after 6 to 7 years of marriage. So she was ready to take any risk, but one of her friend is my close friend. So that in that way she came to me, and medicine was given to her. you can see that no evidence of any obvious intracranial cyst. In the risk factor in plexus cyst is that there is chances of mental retardation of the child, or mental or physical retardation of the child after birth. So usually what they do is that they will terminate the pregnancy if a choroid plexus cyst is seen during in pregnancy during scan. Again, my prescription is the same, but I have given some other, I don't remember the other drugs, interim drugs which was given, but Rutazix and Calcarephos 3X. This is internationally renowned, internationally famous and scientifically proved prescription for brain tumors. So have not gone through that, please go through the book written by Dr. Banerjee, and you should prescription in cases of brain tumors when you get in your clinic. Patiently wait for a few months. Do investigations, MRIs once in 3 to 4 months, and you can observe that the size of the tumor is reducing. Another case of psoriasis. This is before treatment. My favorite medicine in treating psoriasis. Of course, symptomatology matters. I don't want to explain to you about that you take the case if there is an uncommon peculiar characteristic of any drug, you can prescribe that. But to me, without sulfur, I cannot treat psoriasis. It's almost a specific for me in treating psoriasis. I start the treatment with few doses of 0/1. Start from 0/1. Symptomatology matters. I'm very much into that, but if I say graphitis or calcarea sulf or cali sulf to you now, but it's not you should get that particular patient the same modalities. So what here I would like to share to you is that a protocol which has been used by me for the past 30 years, which has been found in more than 50 to 60% of patients, useful in 50 to 60 to 70% of patients. So if you are not clear about the prescription, what you may, because the symptoms may not be clear, the patient may not be that eloquent in narrating his or her symptoms to you, then you can definitely make a prescription like this, so that it will be definitely beneficial to the patient. So next case, you can see this. If you ask me, a mother tincture which can be used in psoriasis, it's Ocimum sanctum. Ocimum sanctum, 15 drops BD is, I always prescribe that along with other drugs, which is given continuously throughout the course until the patient is better. Next is vitiligo. You can see few cases before treatment. This is after. This slide should come before that. Another case, you can see the lesions on the eyelids. Yes. Before, after. Before, after. Before, after. I always start my treatment in vitiligo with a single dose of cifolinum. Cifolinum is my favorite in treating vitiligo. Then my prescription is that I give mica 30, MICA, mica 30, weekly 1 dose. And for external application, Ammi Visnaga mother tincture. Ammi Visnaga mother tincture as external. Of course, arsenicum sulflavum is given continuously, but my choice of potency is 4x. Many use 3x, 6x, but you try 4x. I think it's more effective than any other potency. It should be given continuously BD. The case of nephrotic syndrome, I'll show you the change of the how before treatment and after treatment. See. Nephrotic syndrome is a huge subject, kidney diseases. I have already spoken about this earlier in this program about kidney disease, so I don't want to explain about that. Next is alopecia areata. Before treatment. After. Alopecia areata, acid floor. Acid floor is, they have found the most effective medicine is acid floor. You can give 10 ml or cm one dose and wait for 1 month. Intercurrent remedies is you can use Ustilago mother tincture. Ustilago mother tincture. No, sorry, Ustilago 30 BD. And for local application, again, I would suggest Amivisnaga. Amivisnaga is my choice for external application on these lesions. And other drugs intercurrent, you can give sulfur LM potencies. Then Amloki mother tincture, that is the gooseberry, can be given inside 20 drops twice, which will promote hair growth. And if it's a fungal infection, or you should distinguish between that. If it's a fungal, if the tinea corporis or tinea capitis, that will also lead to hair loss in as round patches. So that has to be differentiated from this other type of hair falls. So once you are sure that this is alopecia areata, then this protocol will definitely give you good results. Next is a case of gangrene. You can see the result of gangrene. This is before treatment. As you all know that if such a case is presented, if you take this patient to a multi-specialty hospital, the first thing is that they will amputate. Of course, the patient was also advised for an amputation just below the knee because there was total block of almost all the cells. It's a chronic diabetic patient. Now you can see the changes happening. For this particular patient, 2 doses of Cecalicore 10 was given today night and tomorrow morning. And arsenic alp 6C was given every 2 hourly. And the mother tincture was given, was Glyceraceae glabra. You can read Glyceraceae glabra. It has the power to rejuvenate the blood vessels, to remove the blocks, to dissolve the blood clots. So Glyceraceae glabra was given twice daily with arsenic alp 6C very frequently, like every 2 to 3 hours. After 1 month, instead of arsenic alp, Crotalus horridus 6 was given in the same manner. Intercurrent remedy given was tarantula because the patient had severe pain. So in my experience, one of the best drug which you can give even in gangrene, pain in gangrene is tarantula. Tarantula cubensis. 30 was given 2 doses daily. But my administration is different. I dissolve 1 dose in half glass of water and ask the patient to stir and take every 2 hourly. So the doses were divided and taken frequently. Next is a case of hydrosalpinx. The beauty of this particular cure is that you can see the date. The patient had severe abdominal pain, was referred for an ultrasound by myself, and the scan taken on 22nd 4/20 shows that she had right hydrosalpinx and was advised for a surgery. But within 4-5 days, the pain subsided. The patient was absolutely fine, but the parents had an anxiety that what will happen to her fallopian tube because they were educated and they knew. And of course, other doctors scared them by saying that it will burst and she will be in trouble. So a scan taken after just 8 days, 7 days, 29/4/20 shows that there is no significant abnormalities. So this is the beauty of homeopathy. Who told homeopathy is slow? Homeopathy is the fastest. Very simple prescription. Right side, severe pain, my specific drug, and absolutely no thirst. Epis was the drug. My choice of potency is 3x and was given very frequently. And pain from slightest movement and from slightest jar, Bryonia was given high potency 10 1 single dose and nothing more, nothing less. When the pain subsided, within 1 day, the patient was getting good relief from this prescription. So that's the protocol. Other drugs, of course, Belladonna CM is a wonderful drug, which a single dose can be dissolved in water and can be given frequently in all types of infections to relieve the pain and inflammation. So one dose is okay. You give one dose, but divide the dose and give. So that's a you get a little bit more assurance that some action you can the patient will receive some action, because if something happens with that single dose and doesn't get the action, so now you cannot repeat that, and moreover this pathology has to be reversed because these are all dangerous pathologies. So that's my method of dispensing, or my advice. I advise my patients to take these single doses in 1 glass of water, 34 glass of water, and very frequently, every 2 hours from that. It's a wonderful case. It's a case of CA thyroid. It's a papillary cell carcinoma. You can see the patient's name is Razia. Malignant that's 5. There are 3 lesions. One is pathocystic lesion, 1 into 0.4 in the right lobe. Then isthmus has 1.2 into 0.9. And the left lobe has 1.46 into 1.4. So this is confirmed as a malignant TRADS 4 type of TRADS 4 is the categorization when you get when you do the ultrasound scan of the thyroid. Now you can see that I took a CT scan later and found that the visualized thyroid gland appears very normal. Sorry that you can just review. You can see that the patient's name is Razia. The visualized thyroid gland appears normal. For all, see, we don't have much of a time. Already half an hour is lost, or half an hour is over. So I should abbreviate my prescriptions to you and management. We don't have much of a time, because talking about papillary cell carcinoma of thyroid itself will take few hours. The management, the diagnosis, and what all the investigations has to be done. But in treating in malignancies, other than specific, there are certain drugs which are specific. As I said, in brain tumors, as you Ultra-6 is almost as specific for me. Otherwise, Catharanthus is a particular medicine which it's my favorite. I always it's found in almost all of my prescriptions. Why? I have explanation for that. In modern medicine for cancers, they use a chemotherapy drug called vinblastine or vincristine. The brand name is called Oncovi. You refer any one of your cancer patients who have undergone treatment. This is one of the most popular chemotherapy drug, vinblastine, vincristine. Catharanthus, the common name of Catharanthus is Vinca rosa. And the alkaloid which is seen in Vinca rosa is vinblastine or vincristine. So that's why actually in homeopathy, the most effective chemotherapeutic drug in homeopathy is Catharanthus. Not a rare drug at all. It's a very common drug. It's seen in your household, in your garden, or in your backyards. In Kerala, it is very common. In Kerala, we call it Shavam Nari. But why Catharanthus or why Vinca rosa? Because this contains an alkaloid called vinblastine, vincristine, which is a very powerful chemotherapeutic drug used by the modern medicine. Then, of course, calcarea floor was given, Cilicia was given to this patient. Constitutionally, she was lachesis. So, lachesis LM was given. LM potency was given. Alternate days, 1 dose. 0/1, then 0/3, then 0/6. Very rarely I go for 0/12, but up to 0/6, I repeat. The case of adenomyosis, as you know that a very painful situation for the patient, have menorrhagia and dysmenorrhea. The patient's name is Julia. So many other things like diffuse adenomyosis, adenomyoma is there, endometriotic cyst is there. This Julia, now it's only bulky uterus with subserosal fibroid. The adenomyosis is not there. Usually in adenomyosis, if the patient has severe dysmenorrhea and has 1 or 2 children, what a gynecologist usually advise is hysterectomy, because it's very, very painful. The menses becomes very painful. But for us, we can very well manage. This is not a single case. I can show you more cases. I have so many other cases also, complete liquid cases of adenomyosis. Of course, the pain has to be managed. That's what I told you earlier. You can make any prescriptions holistically, miasmatically, symptomatically, but at least the patient will wait for 1 or 2 menstrual cycles. And by the time you have to give a relief to the menstrual pain. Otherwise, the patient won't stick to you. So here, my choice of drug for giving relief to the pain is Scolophyllum mother tincture. There are 3 drugs which are very useful in treating dysmenorrhea. One is Scolophyllum, other is Viburnum opalus, and third is Actia racemosa. These 3 tinctures are very useful. There are other drugs also. Sometimes we might not have even thought about a single drug called cholinsonia, which is very effective in dysmenorrhea. And for adenomyosis, a pathological prescription, conium 3C, Tuja 6, both are very effective, can be given BD. Intercurrent remedy, which you can give monthly once, is tuberculum 10 1 dose can be given. Multiple ovarian complex cysts. Here the patient's name is Dhanya. Dhanya has multiple right ovarian complex cysts. You can see mildly enlarged right ovaries. The cysts are disappearing slow by slow. It's the previous one. I think one slide is missing. The next slide is missing. The ovaries are normal. Right ovary, ovarian cysts. Let it be simple cyst, polycystic ovary. I don't want to be in between. When we just raise through the slides, after a few slides, we can see a number of cases of PCOS, which I will not be explaining to you because a few months back I have just taken a class just alone, PCOS alone, and have explained the pathophysiology, the method of prescription, investigation, everything. So otherwise, you'll not be able to explain more about other the diseases and prescriptions. So right ovary, a right ovary, my specific is lycopodium, because lycopodium is a wonderful antipsychotic drug. A scientific study of lycopodium, I have it with me, and it says that it's a wonderful drug for malignancy and for any type of growths. So lycopodium was given. Palladium is a specific for right. Palladium 30, lycopodium 30. Then of course, Tuja is always our choice in such cysts and tumors, but the potency is 3C to 6C, where you can frequently repeat it and you will be getting good results. But in malignancies, I think in my experience, Tuja has not given much of a result. Benign tumors, Tuja is very good. But in malignancies, Tuja has not given me results in many of the cases. Of course, in some cases, definitely, but not a big choice in malignancies. But in benign, of course, definitely it's a wonderful drug. Fibroids, uterus, I will show you a few cases, and after that we will discuss. This is Darshini, you can see fibroid uterus. Darshini, only left ovarian cyst, no fibroid uterus. Another case. This is Kavita, you can see bulky uterus with fibroid, ovarian functional cyst. Next is Kavita. Absolutely no significant abnormalities, no cyst and no fibroid. Another case of Renuka Devi, you can see 2.8 into 2.5. It's a recent one. I think I last week, few days back, the patient visited. First she came on, you can see 7/9, but the patient came on 12th month, December. And we started the treatment in December 2023, had a fibroid of 2.8 into 2.5 centimeters. It's a quite big fibroid, calcified uterine fibroid. It's a calcified also. And pedunculated subserosal broad ligament fibroid. You can see that there is no evidence of mass lesion, and the scan is taken 3rd of May, that is 5 days back. So only thickened endometrium, this mild adenomyosis. The patient is 54 years. Definitely chances of adenomyosis is there, but no fibroid, no calcified fibroid, and the ligament issue. Fibroid. In fibroid, my choice of mother tinctures, Solidago and Fraxinus americanus. Fraxinus and Solidago. That's my choice. Again, conium 3C, conium maculatum 3C is my choice, which I give very calcareous fluid. And if there is menorrhagia or menometrorrhagia, then Talapchi bursa pastoris is a wonderful drug. And many of my friends also have gained good results with Talapchi TBP in treating fibroid uterus. So one of my friends is a blind prescriber in all fibroid uterus, Talapchi bursa pastoris mother tincture, but he has got wonderful results, more than 50% complete resolution of fibroid. So that's I think some pathological action of Talapchi is there in fibroid uterus. Next is ovarian complex cysts. You can see right ovarian cyst of Safia. Safia, the cyst is gone. I will show you a few cases of cyst completely, ovarian cyst, right, left, endometriotic, then all these things. And after that, I will tell you the protocol. It's an endometriotic cyst, but endometriotic cyst, there's a specific drug. You can see the left endometriotic cyst for the Bracina, and same Bracina, you can see only Nebothian cyst. Both ovaries are no mass or cystic. So for endometriotic cyst, Hydrastis canadensis is a specific 3x. This is the potency of my choice. In endometriotic cyst. And Rolfia is also a wonderful drug in endometriosis. Rolfia, but usually we give for higher hypertension. Then, of course, in endometriosis, the symptom is, there are two symptoms. One is severe bleeding, second is pain. So something which covers both. Colinsonia is a wonderful prescription, because colinsonia covers both the cardinal symptoms of endometriotic cyst or endometriosis. So then you prescribe symptomatically, take the cardinal modalities. Modality is very important. For me, I get only 5 to 6 minutes for one patient every day. So I abbreviate my questions to modalities first. So many times the specific medicine is prescribed on the basis of modalities, and we get wonderful results also. So if the constitution is clear and you are sure about it, prescribe. But otherwise, take the presenting complaint, the most important symptom of the patient, take the modality of the symptom. Because the patient came to me with back pain, lumbago. The patient says, absolutely, he doesn't have pain while walking, while sitting. He can do all the jobs, but Once he lies at night in the bed, especially in the back, lying on the back, immediately he starts paining after 5 to 10 minutes. So he cannot lie down. So for the past few days, he is sitting on the chair and sleeping. For me, there are so many drugs you can read, lying down aggravation. But for me, kali iodide is a specific where you have this particular modality. All the symptoms, lying on the back aggravation is kali iodide for me. When you prescribe and get good results. Kali iodide was given and the patient was much better. So that is the importance of modality in a particular symptom. So the most important symptom and its modality. That should be the first criteria of prescription. If you have enough time, okay, you go for a detailed case study. Breast ductal dilatation, benign. You can see Mrs. Mary, focal duct dilatation at 6 o'clock. It's a benign one. The Mary, it's a normal study. The latest study shows that iodine is a specific medicine for, or iodine is a specific compound for breast abnormalities, for fibroadenosis. It's not the latest one, few years back actually. For any duct problem, any fibroadenosis of the breast malignancies, you just search the Google, iodine and breast cancer. You just Google iodine and breast cancer. You can read the effect of iodine in breast cancer. We have a wonderful drug called iodine mother tincture or iodine 3x. You just use it in fibroadenosis or breast cancers. I can guarantee that you will get wonderful results. So iodine 3x is one specific. Other is conium maculatum 3C and hydrastis 3x. Hydrastis tincture is also good, but my choice is 3x. So all these are given BD. If there is severe pain, then conium is given very frequently, maybe 2 hourly. 3C. But otherwise, conium 6C is used BD. This is a case of left ovarian cyst. Right Lycopodium palladium and left lachesis is almost as specific. Use LM potencies. Another drug is podophyllum. It's specific for ovarian tumors or ovarian cysts. And always take the modalities. If there is pain aggravated lying on the right side, pain aggravated lying on the affected side, pain ameliorated by pressure. So all these modalities has to be considered before you prescribe. What I like to share you is what I said earlier, that those protocols which are found effective in more than 50% of cases. What I usually do is that cured cases are taken collectively, and I study about what prescriptions are being made in these cured cases, and a study of these drugs that have been done, so that you doesn't make much mistakes to get good results in future. Okay, every patient has to be taken individualization, everything is there, but if you are treating 100 to 200 patients daily, this is impossible. But you have to produce results also. So in your future also, in your clinic in future also, I think this is the best way, so that we can do it in a very scientific way. When you can cure a particular disease up to 50% with a particular protocol, then that is what is called science. Randomly, when you treat 100 cases of fibroadenosis of breast and you cure only 2 cases. So in the modern world, I don't think nobody will accept that. So you should, even in double blind method, you should get a result of at least 50%. So believe me, so this is how homeopathy should grow, and you also should grow like this. So if you study cases like this, cured cases like this, then you can be more successful in your practice. Polycyst, I will not explain because we had a section a few months back. So many cases, I can show you hundreds of cases cured with homeopathy. The hemorrhagic cyst, if it's a hemorrhagic cyst, first of all, it's very difficult to identify whether it's a hemorrhagic cyst or a normal cyst. because if you take ultrasound in two different places, one place it will be hemorrhagic cyst, another it will be a normal cyst. So there is no specific medication for the right ovarian hemorrhagic cyst. As I said earlier, right and left, you can treat accordingly as per the sites. And hydrosis you can give, and symptomatically, dysmenorrhea, menorrhagia, menorrhagia, and all other symptoms which are associated with the main complaint. So that has to be considered while you prescribe the drug. Always use, and when you manage all the pathologically advanced diseases, my experience and my humble request to you is that always use low potencies. Low is not 30, even below that, 3C or 6C, 3X mother tinctures, because you need to repeat it frequently. Giving one dose of 200 and asking the patient to wait for 6 months, this is not practical. This is not practical. Nothing will happen. If you go wrong, then what will happen? And what about the patient? Patients nowadays are very well educated and they want to know what is happening in their disease. They will do investigation themselves. And you are liable to give a relief to the symptoms of the patient. The modern medicine are treating all these diseases not by curing these diseases, but they are giving a relief to the symptoms of the patient. And the patient says that I get that the disease is, they will get a sudden relief for the symptoms from modern medicine. That's why they go to the modern medicine treatment, not because they cure every disease or every patient. So giving relief to the patient is equally important. So we have to give emphasis to that when you treat this disease and pathologically advanced diseases. Here, Purnima is a normal. So the PCOS. This is a case of hepatomegaly with bulky pancreas. Senthilkumar had enlarged liver. You can see the pancreas, bulky edematous, reduced parenchymal volume with heterogeneous ecotexture of the pancreas, chronic pancreatitis. You can see the after treatment for same Senthilkumar. So after a few months, pancreas appears normal in size, shape, and contour. It's hepatomegaly with fatty infiltration, otherwise no abnormalities. You have seen all signs of chronic pancreatitis in this patient. As you know that other system has nothing much to offer in chronic pancreatitis. You see the values. The amylase was 1407. Now it's 37 and lipase is 28. Again, another, after these cases, I will tell you what is the prescription. Fatty hepatomegaly, bilateral renal, both. Hepatorenal syndrome. This is called hepatorenal syndrome. Both the liver and the kidney, both are affected. You can see the enlarged size with diffuse fatty infiltration, normal size with increased echo texture of renal CM differentiation maintained. This is grade 1 nephropathy. So in ultrasound, I will just explain to you how it's grade 1, grade 2, grade 3, grade 4. Grade 1 is increased echo texture. And the kidney has got the cortex and medulla. And in the second grade, the cortex and medulla has got a differentiation. We can clearly differentiate between the cortex and medulla. That differentiation is altered in grade 2 of renal nephropathy. Grade 3 nephropathy, the CMD, corticomedullary differentiation is lost. And grade 4, the kidney is shrunken kidneys. That is how it is categorized. Here you can see mild increase in parenchymal echogenicity. Kidneys appears normal in size, shape, position, and movement. The liver is normal and the kidneys are also normal. Liver, maybe this will be a surprise to many of you. In homeopathy, if you say liver, then cardus, chelidonium, phosphorus, colostrinum, all these drugs. These are the drugs which come to our mind. But to me, sulfur is one of my specific in treating liver diseases, and I use LM potencies. Of course, in cancer liver, other drugs are there, and colostinum is one of my favorite in treating chronic liver diseases, colostinum 6C or colostinum 3X. And here, the drug given was Tinospora quadrifolia, the mother tincture. So the property of Tinospora quadrifolia is that it's a wonderful liver tonic as well as a kidney tonic. So this will stimulate both. It will rejuvenate the liver parenchyma and the renal parenchyma. So Tinospora quadrifolia, mother tincture, that was given along with colostinum 6C and sulfur 0 bar 1, then 0 bar 3, then 0 bar 6. And after 3 months, you have seen the scan. This gallbladder calculus, you can see multiple calculus of Dilip. Now, this scan of Dilip says, you can read the gallbladder, normal in distension, caliber, no echogenic focus. I will show you more gallbladder calculus, and after that, you will come to the prescription. This, no. Anyway, I will tell you the prescription. Colostinum is one of the most specific remedy for gallstones. Again, 3x, 6x to 6c. If you ask me which is the mother tincture which can be used, Cardus is one of the favorite, one of my favorite in treating gallstones. Then Myrica, MYRICA, which promotes intrahepatic biliary radicular circulation. And it improves the stagnation of bile and thereby helps to dissolve the gallstones. So that's the pathological action of Myrica. Of course, phosphorus is one of the most specific remedy for fatty liver. Another drug is Oramet. Always use LM potencies. This is prostate. In a case of benign hypertrophy of prostate, you can see that prostate is 82 cc, 82 cc of Velayudhan, and the same Velayudhan has only 52 cc now. And another case of cholecystitis. Before going to that, for benign hypertrophy of prostate, recently, if I should say that so many cases I have found wonderful result with the drug Sabal Ceruleta 1X. Sabal 1X. We have that, I think Milsrabe has that tablet. Now I give that tablet other than mother tincture, but which is very effective. Another one is Conium 0 bar 3. Conium 0 bar 3. And I give Calcarea carb. Then Barretta carb 0 bar 3 is also very good. Then symptomatically you should treat the patient. If the patient has got severe retention, difficulty to pass, clematis works. Clematis works. In case of retention, 3 drugs: clematis, stramonium, opium. These 3 drugs can be used as per the modalities or symptom similarities in case of retention. But the other one, as I said, LM or low potencies has to be continued. And you can see that the size of the prostate reducing and the patient will be symptomatic. Definitely the patient will be symptomatically better, because as the size of the prostate reduces, the patient will be better. Here you can see another case with gallstones, renal stones, and atrophied kidney. Gallstone, you can see 3 mm, 5 mm calculi. Kidneys, you can see multiple calculi. And there's a mildly small in size. Chronic calculus, small kidneys, bilateral renal calculus. The patient name is Anthony. Same Anthony after few months of treatment under our organization. There's multiple calculi is there, but the Kidney is normal in size, and no stones. And again, Anthony, you can see the gallbladder, and what left was gallstones. And this scan, you can see, Anthony, this scan, where you read the biliary system, the gallbladder size is 56 into 16, normal, no definite calculus. So gallstone is also cured. But I would like to share you one small thing when you treat gallstones. If you find any gallstone obstructing the common bile duct, please don't treat. Refer the patient to a gastroenterologist, because if the stone descends to the common bile duct, now the common bile duct joins with the pancreatic duct in the area called ampulla of Witte. It's a Y-shaped junction where the stone will get blocked, resulting in chronic acute pancreatitis and obstructive jaundice. Now, the modern medicine has a very easy procedure to offer for that. That's called ERCP or MRCP, endoscopic retrograde cholangiopancreatography, where there is no need of any incision, or it's not a minimum invasive procedure also. Endoscopy is introduced, and from the duodenum, the stone is released very easily. So when they have something very good to offer, you should definitely refer the patient, because if the patient develops acute pancreatitis, the patient's life will be in danger. So you always have to check if the patient develops severe pain in a case of gallstone during the course of the treatment. You have to check the bilirubin. You have to check the liver function test. If the bilirubin is increasing, patient has severe itching, then all signs of obstructive jaundice has to be ruled out if there is increased level of liver function parameters. That's very important in treating gallstones.
Yes,
So,
Dr.
then Dr.
Yes.
Danesh,
Yes, we can conclude the session.
Yeah, definitely.
People want to have a chat with you. And what a wonderful presentation with full of cases. That's what we call as a homeopath, multi-specialist, and you are a specific person who can handle such wonderful cases, that is pathologically advanced cases with just like a fluke or just like anything else. So it is the time for discussion. I invite Dr. Hubert to begin the session.
Yes, my dear Hubert, please. Dr. Dhanesh,
just a minute. Just a minute. I am wondering. That's what I have only one question only. I saw you 32 years back.
Yes.
You are still like that. No change. What is the what is the secret behind it? Same. I think that your hairs are more. That time, now the beard and your mustache are all more than, I think that it is more beautiful than the in your our college life. What is the secret?
Homeopathy is the secret, maybe. Like whatever problems I have, I always rely on homeopathy. Then a very disciplined life. I wake up early in the morning. I do yoga for 1 hour. I am a pure vegetarian. No big vices. So happy-go-lucky. Mentally also, I always keep myself happy. Do things which make me happy. I sing, as you know that I am a singer. So I have a studio in my house, just adjacent to this room. So all this put together, I think. Plus, thank you. Anyway, thank you, Hubert, for the compliment. Thank you so much.
You made me a musician. So I'm doing daily. I'm teaching music, even violin, guitar, keyboard, and.
I know. I've seen few videos of yours in YouTube also.
So thank you, thank you, Doctor. Very nice presentation. Everybody knows that it is a very wonderful presentation. Always
thank you so much.
So there are so many people, they want to ask you something.
Yeah.
And now I invite Dr. Bob Lim. Dr. Bob Lim.
Oh, yeah.
Yeah, Dr. Bob. Yeah.
This has been a very, very good this session for Dr. Nandakumar. You really are amazing. You share a lot of your experience.
Thank you so much.
And there, absolutely, we love to hear from you more because I think tonight, within 1 hour, there are too much for us to digest. And
You
I
are
hope
from
that-
which country, Bob?
Ah.
You are from which country?
I'm from Malaysia.
Oh, I have been to Malaysia many times. Yeah.
Okay. We'll keep in touch. And
Yeah, please, definitely.
how to contact you?
Yeah, you can note my number. I think Dr. Danish, or can he tell you? Now you
okay.
can note it down: 94470 67994.
You can write on the chat on the chat box.
I shall share
Oh,
it.
Dr. Danish will share the number.
I shall share.
Okay, thank you. I have been to Kerala before.
Oh, come. Next time, just give me a ring.
I went to
We'll
Cochin
share some
and
good moments. We'll share some good moments.
I went to Malacca also.
Yeah,
So
sure.
I hope that you will share again and let us narrow to a few cases of case taking so that we can digest more. And it's wonderful to hear from you.
Thank you so much.
All the knowledge. Thank you very much.
Thank you.
So that's definitely we will have a second session of the same advanced pathologically cases. The management will be discussed by Dr. Nandakumar in the coming months. As per his convenience, we will arrange the session so that all of us can enjoy.
Dr. Danish, one question from Dr. Rajeshwari that whether we can use one potency. Dr. Rajeshwari,
yes, sir,
I will never use it. I will never use it. That's only what I can say. But some of my friends in Mumbai always say that they use it, but I don't use it. All the remedies used by me in pathologically advanced cases are, as I said, low potencies. Because the vitality is low, the patient is a complex of so many symptoms. So there, we have to repeat it frequently. I cannot give one dose and just tie my arms and sit quiet and listen to what the patient has. Patient develops other new symptoms, the pain, the aggravation of other symptoms. When you give a particular, you see, you gave one dose, the symptoms aggravated. Then what will you do? When I start with LM0/1 and the patient says the patient doesn't have any relief, one thing I am sure, it is not an aggravation. It is because this potency is not enough. This strength is not enough, or this repetition is not enough. I can go for the next because it is very low. So what if I give a higher potency, then what will I do? So you should always, in managing, in any case, let it be cancer or any other pathologically advanced disease, you should create a room for yourself for repetitions. Then only you will be able to manage it successfully.
Anyway, it's a time to say a vote of thanks. I invite Dr. Bobley once again to say the vote of thanks to the session also.
On behalf of the IFPH, the International Forum for the Promotion of Homeopathy, I'm Bob Lim. I would like to say a very big thank you to Dr. Nandakumar for sharing his amazing experience in handling all the very chronic, serious cases. And it is a very successful 134th webinar today, 8th of May. And once again, thank you very much. And we
Thank
hope
you, Doctor. Thank you,
very
Doctor.
soon.
Thank you so much. Thank you so much.
Over to you,
Dr. Danish, once again, thank you so much for this opportunity.
Thank you.
Thank you. Dr. Hubert, bye from now.
Yeah, Dr. Hubert too.
Thank you, thank you,
We were
Dr.
classmates. We were classmates.
Yes.
32 years back.
Thank you, Dr. Boblim and Dr. Hubert and Dr. Nandakumar for such a wonderful session. And we thank all of you for joining the session. We will definitely upload the videos of the same tomorrow itself so that those who missed the session can watch and again You can study homeopathy in a better way, and you can practice homeopathy. You can propagate homeopathy to people around the world. With that, we come to the end of the session 1337. Thank you all.
Thank you so much. Thank you so much. Thank you.